When something happens to you over and over and over and again, something that you would initially was shocking to you, and it happens over and over and over again, you tend to not be shocked by it anymore. You tend to be like, wow, yeah, of course it's that way. It's always that way. I've heard that a million times. I've seen that happen before. Of course it's that way. On a daily basis, pretty much on a daily basis, we still get shocked here at the clinic because we'll see a new patient and they'll tell you a story that you've heard over and over and over again, and you're still shocked that you're hearing this story. So the other day, a patient came in. She said that she'd had some trouble swallowing and she had a myriad of other symptoms. Your body just wasn't working right. She was feeling really bad. And this is where it sort of gets where you're like, oh my God, I've heard this so many times, yet it's still shocking. She'd been to 7 different doctors and specialists, 7. She recently moved here and she came to see us because we do functional medicine, root cause medicine. And recently she had stopped doing traditional medicine. I'm not advising somebody to stop doing traditional medicine. I'm just saying she wasn't getting the answers. 7 different specialists and nobody found the problem. She went to where she used to live. She went to a root cause medicine doctor, a functional medicine doctor. Functional medicine doctor looked at her lab work, looked sort of between the lines on the lab work and looked at those optimum ranges and found that she had Hashimoto's, which is an autoimmune disease for the thyroid. Now, if somebody has trouble swallowing, one of the first things you should be looking for is thyroid issues. But 7 doctors and specialists, nobody looked. Nobody cared to look. So she went back to her primary care doctor after the functional medicine doctor said she had Hashimoto's. And that doctor said, well, we're just going to put you on Synthroid, which is the standard of care treatment, levothyroxine Synthroid for somebody with Hashimoto's. And then we're going to do anything for the underlying causes of that. But between her seeing the functional medicine doctor and going back to her doctor, she did a tremendous amount of research. It was interesting because she went back to her doctor and she said, it was found out that I have Hashimoto's. And the doctor was like, how about that? And the doctor said, well, maybe you should just take some turmeric. That was the only other advice they had, was just to take some turmeric other than taking the Synthroid. So these are the types of stories where you're like, wow, all the things that can be done to help somebody with an autoimmune issue from a root cause perspective, which we do in our office every day. And this doctor said, maybe you should just take some turmeric, which frankly is a little bit better than most doctors would say. But that was all they had to offer. And this lady, she said, I felt like going back to my doctor and handing her just a ream of paper full of research on showing what can be done for somebody with Hashimoto's if you're willing to do the right digging. So you're not just throwing stuff at the wall and seeing what sticks. There are things that you could do to help somebody if you know how to do the right lab work, how to do the right detective work to determine what's driving those problems. This doctor was simply like, take some turmeric to lower your inflammation, take some Synthroid, good luck. And anyway, so I thought it was just a little bit shocking. Again, you hear those numbers, you're like 7 doctors, 7 specialists. And then when they go back to their doctor, the doctor sort of brushes it off and says, well, I guess you could do something natural, like take some turmeric. And that's the only thing they had to offer. So a little bit shocked by that. I get shocked like that pretty much on a daily basis at the office because you just expect that someday the whole system's going to wake up to the fact that there's a better way of doing things. It doesn't mean that modern medicine and the tools that we have are never useful. It just doesn't fix chronic disease. It only promotes and keeps somebody sick and manages disease. Managing and fixing are 2 different things. I don't want to manage a problem with my car. I want the mechanic to fix my car. I don't want him to manage it. I want him to fix it. Anyway, Dr. Dave Morris of Magnolia Medical Center. We're a root cause medical center here in Murfreesboro, Tennessee, Middle Tennessee. It's the geographic center of the state. We also do responsible pain management. I also have a company that allows you to upload your lab work, and we can send you a report regarding your lab work to tell you how for yourself you can read between the lines and get that information that your doctor's not giving you. Anyway, it's functionallabhackers.com if you're interested. I hope you found this information helpful. Hit the follow button, hit the share button, and hit those little likes. Take care. You can leave me some comments too.